Welcome to Guelph Community Health Center. As a new clinical client, we would like to spend some time sharing some information about us and what you can expect from your care here. We will start out by telling you a little bit about Guelph CHC's vision and who we are. Guelph CHC has worked in the community for more than 30 years. We provide access to health programs and services in order to help people improve their health and well-being. Your health matters to us. Our staff and volunteers are here to help you on your health journey. If we don't offer a service that you need, we will do our best to help you find it. Guelph CHC is a registered charity that is overseen by a volunteer board of directors. We have over 140 staff and 200 volunteers who work at multiple locations. What impacts health? At Guelph CHC, we realize that there are a number of things that impact health, and some of these are listed here. We try to help our clients in many areas of their lives. Health isn't just about not being sick or making healthy choices. We have control over some of the things that improve our health, but some things are out of our control. Many of the people that we work with have barriers to health in one or more of these areas. Guelph CHC's 3 program areas are healthcare, community programs, and early on. Healthcare. At Guelph CHC, our clients may work with a healthcare team, including doctors, nurse practitioners, nurses, social workers, dietitians, and outreach workers to help manage their health. When helping our clients to stay healthy, we consider all areas of their life and how it affects their health. We believe that health promotion and preventing illness is as important as treating an illness. Community programs. Did you know that Guelph CHC also offers lots of great community programs? Some examples are yoga, Zumba, English conversation practice, nutrition workshops, programs for people with chronic pain, Indigenous healing and wellness programs, programs for stress reduction and mental health, breastfeeding support, and social groups. Most of these programs are drop-in and free of charge. If you are interested in any of these programs, please talk to your healthcare provider or any of our staff members. All of these programs can be found on our monthly calendar, available on our website at guelphchc.ca and on paper copies throughout our building locations. Early On. The Guelph CHC Early On Center is located on the 2nd floor of Stone Road Mall. It is easily accessible by bus and also has free parking. The Early On Center offers fun and free activities for children and their parents and caregivers, with the goal of supporting healthy child development. Program examples include infant massage, Daddy and Me, Circle of Security, Bounce Back and Thrive, and others. Many of our programs are also offered virtually. We provide parents with support and information. If we are unsure of the answer, we will certainly help you find it. Early On programs are open to children from birth to age 6 who are with their parents or caregivers. More details about Early On programming can be found on our website, the Early On Facebook page, and through our seasonal calendar. Health promotion. Every aspect of Guelph CHC's work involves health promotion. Staff from healthcare, community programs, and Early On all work together to help individuals and communities to take care of their health. We focus on preventing disease, reducing illness, improving quality of life, and supporting community and social change. We do this through education, skill building, advocacy, community development, and partnering with other agencies. Social prescriptions are prescriptions for social, emotional, or basic needs that are written by doctors, nurse practitioners, and allied health workers. We work with our staff or community partners to connect clients to programs and services that are both fun and build social connections. Social prescriptions are filled when the client is meaningfully connected to these supports and their needs are met. Many social prescriptions have been made to food access programs, such as the Seeds Fresh Food Prescription Program. But we also know that reducing loneliness and isolation can have a big impact on health. So many of our social prescriptions are made to programs and services that increase a sense of belonging, build social connections, and bring joy and fun into our lives. Consumption and Treatment Services is a health service that provides a safe, hygienic space for people to inject pre-obtained drugs under the supervision of staff. A team of nurses, peers, and in-reach workers provide sterile injection supplies, education on safe injection, overdose prevention and intervention, as well as connections and referrals to other health services. Consumption and Treatment Services is a low-barrier, life-saving, time-limited service that offers targeted supports in order to address the current opioid crisis. The Seed is a food project that tackles the issue of food insecurity in our community. The Seed's goal is to make Guelph, Wellington the first community in Canada to eliminate food insecurity by increasing food literacy and access to good food, operating programs that increase food access, train and employ youth, and generate profits that are reinvested to the program, working with community members and partner organizations to make good things happen, advocating for effective change around food and food insecurity. The Seed has a website at theseedguelph.ca where you can find more information. The Indigenous Healing and Wellness Program is community-governed and designed to be responsive to the self-determined needs of First Nations, Inuit, and Métis community members. The program aims to provide culturally safe access to health and wellness services, including traditional healing and therapies, healthy living and well-being programs, outreach, community strengthening, cultural programs, palliative support, and awareness events. More details on how to access programming and reach staff of this program can be found on our website at guelphchc.ca. Locations. Guelph CHC has 3 locations. Our downtown location is at 176 Wyndham Street North and offers healthcare, consumption and treatment services, and community programs. Our Shelldale location is at 20 Shelldale Crescent and offers both healthcare and community programming. Our Stone Road Mall location offers early on programming and can be found on the 2nd floor of Stone Road Mall by the water fountain and elevator. Downtown clinic hours. Here are the clinic hours for our downtown location. We are closed for lunch every day from 1 till 2 p.m. and closed on weekends. On-call services are offered only outside of the hours on the screen. Shelldale clinic hours. Here are the clinic hours for our Shelldale location. We are closed for lunch every day except Wednesday from 1 till 2 p.m. and closed on weekends. On-call services are offered only outside of the hours on the screen. Your healthcare team. At Guelph CHC, we provide comprehensive primary care, which includes an entire team of people that might be included in your care at any given time. Your doctor or nurse practitioner are your primary providers, and they will discuss with you what team members will be part of your care team. Your primary provider will see you each time you come into the clinic. However, we work as part of a team, and not every provider works every hour of every day. So if you need an appointment and your primary provider is not available, you may receive care from another team member. Nurse practitioners. Nurse practitioners have a focus on health promotion, wellness, and illness prevention. They can assess you and make diagnoses, give you prescriptions, and send you for tests. Nurse practitioners work closely with doctors in the clinic. Booking appointments. Our goal is to be able to offer our clients appointments in a timely manner. Often, we are able to offer appointments on the same day that a client calls. While this is our goal, it is not always possible. We encourage you to call early in the day and the receptionist can let you know if your provider has a same-day appointment available. Some providers pre-book appointments, and again, we urge you to speak with the receptionist who can let you know if it is possible to pre-book an appointment with your provider. Pre-booked appointments are always created for clients who require interpretation. Late appointments and cancellations. If you arrive late to an appointment, we may reschedule you for another day. If you need to cancel an appointment, it is very important to call us in advance to cancel. Our clinic is very busy, so it is important to see as many people as possible. When there is a last-minute cancellation, we aren't seeing you, and we don't have the chance to book someone else in. So please call us as soon as you know you won't be able to make it to your appointment. Languages of service. Services are provided in English. Guelph CHC has access to trained interpreters who are available in many different languages. Please let us know ahead of time if you will need an interpreter. On-call service. Guelph CHC has an on-call service for our clinical clients. This is available during times when our offices are closed. You can use this service if you have an urgent health concern that cannot wait until the office is open. If you have a medical emergency, do not use the on-call service. Instead, call 911 or go directly to the hospital emergency room. If you would like to access the on-call service, call the clinic number, select the option to have a doctor paged, and a healthcare provider will call you back. Communication of test results. If your provider has ordered tests and has concerns about the results, you will be contacted for follow-up. If your test results come back normal, you will not be contacted. If you wish to discuss the results of normal tests, you must contact our office to book an appointment. Referral to specialists. Your healthcare provider must assess you before you can be referred to a specialist. This may be done at an in-person visit, over the phone, or by a virtual visit using your web camera. Medication renewals. Long-term medications should be renewed at your yearly health exam. This ensures proper monitoring of side effects and chronic illness. If you run out of medication before your next appointment, contact your pharmacy. Some medications may need an appointment in order to be renewed. Medications will be renewed within 72 hours if your provider feels it is appropriate. Pain medications. If you are taking pain medications, your new care team will discuss your pain with you and help make a plan of care. Your plan of care may include exercise, physiotherapy, and potentially, but not always, medications. Medical forms. Forms often require information from the patient or a physical examination in order to be completed. An appointment must be booked to complete all forms. Exceptions include immunization records and notes for orthotics or massage therapy. These may be dropped off at clinic reception and picked up 72 hours later. We do not complete passport applications. Travel immunizations. Guelph CHC does not offer travel immunizations. If you need immunizations, please contact Wellington Dufferin Guelph Public Health or the Dawson Travel and Immunization Clinic. Transfer of care. Please notify us as soon as possible if you are moving or decide to transfer your care to another provider so that we can make sure your records are transferred. A signed written request will be required to transfer your records. Personal health information and privacy. We need to collect your personal health information to provide you with health care. We collect only what is needed to determine your health care needs. Unless you tell us not to, we share your personal health information with your other healthcare providers. We cannot share your health information with third parties, such as a lawyer, without your express consent. The information we collect belongs to you, and you can give or withhold consent to share that information, except where we are legally required to provide said information. The privacy of your health information is important to us. We have put steps in place to protect the privacy of this information. Do you have a question about your personal health information and privacy? Your healthcare team will review and answer any questions you may have about your healthcare information that we collect, how we protect your information, how and when we share your information, and your privacy rights. Client rights and responsibilities. As a client of Guelph CHC, you have the right to state your thoughts and concerns, be heard, feel accepted, be treated with respect, dignity, and without discrimination, be fully informed about your care, understand your health care, accept or refuse treatment, and learn how doing so might impact your health, feel safe while at the Guelph CHC, take part or not in research or surveys, privacy and confidentiality, have your need for accommodation taken into account, have your complaint heard. As a client of Guelph CHC, you have the responsibility to act in a way that allows other clients and our staff to feel safe, treat others with respect, including respecting gender, sexual orientation, and ethnic, cultural, and religious values of all Guelph CHC clients, visitors, volunteers, students, and staff. Be accountable for your actions. Be on time. Attend the appointments and programs that we have set up together with you. Ask for accommodations when needed. Complaint process. Guelph CHC views every complaint as an opportunity to improve client care and experience, to make our environment safer and improve processes, to build positive relationships. You have the right to complain if you are feeling unsatisfied with your experience at the Guelph CHC. You can ask any staff member how to get in touch with the client care manager. Thank you for taking the time to learn more about Guelph CHC and how we can support you in managing your health. Please feel free to chat with your healthcare provider about any questions you had about this presentation.